Welcome to our channel. Enrolling in Medicare correctly is crucial to avoid penalties and gaps in coverage. Follow these step-by-step instructions to navigate Medicare enrollment successfully. Step 1. Understand your initial enrollment period, which begins 3 months before you turn 65 and ends 3 months after. Missing this window can result in permanent late enrollment penalties. Step 2. Determine if you should delay Part B enrollment. If you have creditable employer coverage through active employment, you may delay Part B without penalty. Step 3. Enroll in Part A, which covers hospital insurance and is premium-free for most people. Apply online atssa.gov, by phone, or at your local Social Security office. Step 4. Decide whether to enroll in Part B, which covers doctor visits and outpatient services. The standard premium changes annually, and higher earners pay income-related surcharges. Step 5. Choose between Original Medicare plus a Medigap policy or a Medicare Advantage plan. Compare costs, provider networks, prescription coverage, and out-of-pocket maximums carefully. Step 6. Enroll in Part D prescription drug coverage if you choose Original Medicare. Compare plans using Medicare's Plan Finder tool, checking that your medications are covered. Step 7. Be aware of the Part D late enrollment penalty, which increases your premium permanently if you delay enrollment without creditable coverage. Step 8. Mark your calendar for the annual enrollment period from October 15th to December 7th. This is your opportunity to review and change your Medicare coverage, prescription drug plans, or switch between Original Medicare and Medicare Advantage. Don't forget to like this video and subscribe to our channel.